Maayong adlaw everyone! Welcome back to my channel. If you are new here to my channel, my name is Cor and I'm your district nurse from Southeast England. Welcome back to my current subscribers. If you are new here, please don't forget to hit the like button and subscribe to my channel. In today's vlog, we're going to talk about the top 10 reasons why nurses fail the OSCE implementation station. Now let's jump straight to our topic. Here are the top reasons why nurses fail the OSCE implementation station. Number 1, not recognizing ineligible prescriptions or errors. So having a valid prescription, it must include the patient's information. There should be the medication's name, the dosage, the frequency, the timing, the doctor's name, and the blip number. So anything missing on those information, that is considered ineligible or invalid prescription. Including this factor is failure to spot medication errors. So for example, one of the nurses of the previous shift has given a medication that is supposedly contraindicated to that patient, and you failed to mention that to the assessor and you haven't taken action, like putting a code and documenting at the back of the MAR chart, then this will fail you in your OSCE implementation skill. Number 2 reason, overlooking the medications that were already administered. So this is more on the stat or single dose medication versus the PRN or as needed medications. Or it can be the PRN medications versus the regular medications. So for example, during the ward rounds, the patient verbalized that he is still in pain with a pain scale level maybe of 6. And then you failed to review the MAR chart properly that the patient has received analgesic like few hours or few minutes ago. And then you offer a PRN medication of the same component to that patient without knowing that there's only a short interval from the previous dose. Of course, you will fail your implementation skill because of this mistake. So make sure you check the interval between the stat or single dose versus the as needed medication, or between the PRN or the stat medication as compared to the regular medication. So be very careful with that because it can be tricky at times if you failed to see that the patient has received an analgesic and then the actor or maybe the assessor will tell that, oh, I'm still in pain. So be very careful not making that mistake. So let me give you a concrete example of this. So the patient has been given a single dose of cocodamol tablet, and then when you scan through the PRN medications, the patient has been prescribed with paracetamol tablet like every 4 hours, and the patient still complains of pain. And then you decided to give a paracetamol tablet without knowing that the patient has already received a paracetamol because cocodamol tablet contains paracetamol. So if there is no alternative analgesics for the patient, then you must verbalize this to the assessor that you will escalate this concern to the prescriber or to the doctor that the patient is still in pain despite receiving an analgesic. Okay? Number 3. One of the most crucial mistakes that you can commit during the implementation is ignoring the patient's allergies. So it's very obvious. For example, the patient has allergy to penicillin, and then there is a prescription saying that you have to give an antimicrobial containing penicillin. For example, co-amoxiclav or amoxicillin. And then you fail to recognize this error and you fail to verbalize and document this on the MAR chart, then obviously you will fail the implementation. The 4th most common reason that you will fail the implementation is having no baseline vital signs prior administering cardiac medications or diuretics. So for example, before giving antihypertensive medications, you must ask the assessor for the latest blood pressure and heart rate of the patient. And as for giving cardiac medications, you must inquire for the recent heart rate of the patient. And lastly, for the diuretics, you must inquire for the latest blood pressure of the patient. In this way, the assessor will know that you have the knowledge when not to give this kind of medications. Number 5, this is a very straightforward reason, giving paracetamol to patients weighing below 50 kilograms. Number 6, giving blood thinning medications for patients who are suspected of having internal bleeding or has active bleeding. So example of these medications are aspirin warfarin, and apixaban. Number 7, it is considered as a major failure in your implementation if you give the incorrect dosage of the medication. So for example, for prednisolone, the available strength is 1 milligram, but the order dosage is 4 milligrams, and you only prepared one tablet. Obviously, it is incorrect. You should have prepared 4 tablets because the ordered medication dose is 4 milligrams and the available strength is 1 milligram. So be very careful on those kind of tricks during implementation. Number 8, failure to identify the patient prior administering the medications. So during your implementation skill, you will at least identify the patient twice. So that is before preparing the medications and of course prior giving the prescribed medications. So if you fail to do that, then you might fail your implementation skill. Number 9 is incorrect code. So in the medication sheet, there are numbers that indicate something. So that is from 1 to 10. And there's an explanation what is that number for, what is that number stands for. So for example, patient refuse. So if you have omitted a dose or if you have spotted a medication error, you must document in the medication administration record the relevant code and you must sign that entry. So you don't really need to memorize these codes because this is written on the medication administration record of the patient. You just have to familiarize them and make sure that you input the correct or the relevant code of any medications that you omitted to administer to your patient. Last but not the least is incomplete documentation. Of course, if you failed to input the correct or the relevant code and then you failed to sign the medications you have administered, of course, that is an automatic failure of your implementation skill. Now, let me share to you other points to remember during the implementation. So, number 1, if the patient has been prescribed of oxygen therapy, you must ask the assessor what is the patient's current oxygen saturation and ensure that the oxygen is on. Number 2, which is very rare. So if the patient has ongoing intravenous fluids, you must check the patient's IV site for any signs of phlebitis, and you must check also the ongoing IV fluid for its batch number, expiration date, the flow rate, and the running time. It is also worth to note that you can give or administer 2 antihypertensive medications at the same time as long as the patient's blood pressure is within the normal range. However, if you're not really confident to do this, then you must verbalize to the assessor what will be your action. Number 4, ensure that the patient has swallowed the medications before signing the medication administration record. Number 5, in case you encounter any antihyperglycemic medications, ensure to ask the patient when was the last time he has eaten and also to remind them that they have to eat after you administer the medications. So most of the antihyperglycemic medications are with meals. It is crucial that you have to lock your medication trolley and keep your medication keys in your pocket after you prepare your medications. And lastly, it is helpful that you familiarize at least 2 side effects of common medications that are given during the implementation skill. So as a bonus to this vlog, I'm going to share to you what are the common medications that you will encounter during your implementation skill. And this is basically based on your scenario during your assessment. So if it is relating about cardiovascular diseases, you will encounter antihypertensive medications and cardiac medications such as lisinopril, amlodipine, bisoprolol, and digoxin. And if your scenario is relating to asthma or any respiratory related problems, you might have this kind of medications like prednisolone tablet, salbutamol, and theophylline tablet. So if your scenario during the assessment is relating to subdural hematoma or suspected bleeding, you will likely have these medications such as analgesics like paracetamol, cocodamol, and ibuprofen, and also diuretics like furosemide tablet. And to trick you for this kind of situation, you will be given blood thinning medications which you are not supposed to administer. These are your clopidogrel, apixaban, warfarin, and aspirin tablets. So if your scenario is relating to diabetes, you will encounter metformin tablet, glycosides. And lastly, if your assessment is about pre-op or post-op preparation of a patient, you will encounter medications such as antiemetics like metoclopramide and antibiotics or antimicrobials such as penicillin, amoxicillin, coamoxiclav, whatever other common antimicrobials like trimethoprim. So make sure to familiarize those drugs and also take note of the most common side effects so that it won't be hard for you during the implementation skill. So hopefully you find value from this vlog for today. If you think this video will be helpful to your friends or colleagues who are preparing for OSCE, please don't forget to share. So thank you very much for watching this vlog for today. And if you haven't subscribed yet to my channel, what are you waiting for? Please hit the like button and subscribe to my channel. I'll see you soon, guys. Bye-bye!